Okay, I have 4 p.m. Good afternoon, everyone. This is Kim Hill. I'm Superintendent of Charles County Public Schools, and I'd like to welcome all of you to a town hall specifically created to address the concerns of our employees. We can't do what we do without the dedicated people that work for Charles County Public Schools. And so these next 2 hours are to answer your questions and address your concerns about our phased reopening plan. So before we get started, I'd like to say a big thank you to our communications team for putting this together for us. Not all of us are as technologically savvy as the members of this team, and I appreciate their work in getting this ready and taking care of registering the participants and getting us out streaming on YouTube. At last count, we had about 150 registered participants and many others watching on our YouTube channel or on our CCBOE website. Welcome to all of you. We're glad that you're here. Over the next 2 hours, we're going to do our best to provide information and answer your questions about our phased reopening plan. We're going to try to provide clarity in a situation where everything is fluid. And we're going to try to alleviate some of the anxiety that comes with change. To start us off, we're going to take about 20 to 25 minutes and conduct a presentation to try to answer many of your questions through this presentation. The people who are going to help present this information are subject matter experts and people who have been working nonstop for the last 7 months to prepare us for the continuity of learning and teaching in our county. So I'd like to introduce the presenters, and you'll hear them when it's their turn to speak. But on our panel, we have Deputy Superintendent Amy Holstein. We have Assistant Superintendent for Supporting Services, Michael Heim. We have Assistant Superintendent for Human Resources, Nikki Majors. We have Jason Stoddard, our Director of School Safety, and we have Shirlene Ogburn, who is handling most of the accommodations work in our Human Resources office, excuse me. So after we do this presentation, as I said, about 20, 25 minutes, we're going to answer your questions. But the way we're going to do that is that we're going to, at the end of the presentation, enable the chat feature on Zoom. So you'll notice that the chat feature is not yet able to be accessed right now, because while we're doing the presentation, most of us were teachers a while back, and we know that if the chat's going on, you may not be paying attention to the information we're presenting. So we're going to ask you to pay attention to the presentation, and then at the end of the presentation, we'll open up the chat and we'll answer your questions. An important part of today's presentation is that this isn't just CCPS telling you what we think you want to know. This presentation is a collaboration between Charles County Public Schools and the Education Association of Charles County, or EACC. So Linda McLaughlin, the president of the EACC, Dawn Pipkin, the UniServe director for the EACC, and our team have been in almost constant communication with each other over the last, as far as Linda goes, 7 months, over the last 7 months. And Dawn just came on board, so I had the pleasure of getting to know her a little bit over the last few weeks. But this is something that a lot of other school systems don't have, and that is a very strong relationship and partnership with the employee advocacy groups. So Linda and Dawn will be monitoring the chat, and they will be putting together the questions and reading the questions to our panelists so that we don't repeat questions over and over again, but that we make sure that a wide variety of questions are answered during the 2 hours we have to devote to today. So you'll hear more from Linda and Dawn in just a minute, but Kyle, if you'll move to the next slide, I want to get us started on the presentation. So 7 months ago, COVID-19 burst upon our world, and it just changed just about everything that we do and how we do it. I think I wouldn't be alone in saying that in March, it was a shock that schools got closed by the state superintendent. But I think all of us thought, oh, well, we'll be back in a couple weeks. And then a couple weeks became a couple of months. And we were all struggling to wonder, are we coming back? Aren't we coming back? I mean, you remember all of that and all of that stress of not really knowing what the future holds. And part of what today's presentation is about is to try to provide, as I said earlier, some clarity about what the future holds. So some of that stress about not knowing can be reduced. It won't go away, but it can be reduced. Next slide, please, Kyle. So once COVID hit, everything changed. But what didn't change is the way Charles County Public School employees responded. And there is a whole list on the screen there of just some of the examples of the things that you did, our employees did, to step up and to respond to the needs of our children and the needs of our community. And I cannot put into words how grateful we all are, and that I know our Board of Education members are, for the work that you've done over the last 7 months. None of what is on the screen there, and I'm not going to read it all to you, but none of what is on the screen there would have happened if you all didn't step up and say, what we do is important, what we do matters, and our community needs us. So thank you for that. On behalf of the members of the Board of Ed and all of us who work in Charles County Public Schools, we're proud of what you did. Next slide, please. So our goal, even though the whole world has changed, our goal remains the same. And that is to provide outstanding teaching and learning in a safe and effective way. So what I'll ask for from all of our 3,500 employees is your grace in recognizing that all of us are in uncharted territory, and we are all responding and trying to react to changing guidance and changing data regarding COVID-19. And we respond as quickly as is possible. But I know you're frustrated that sometimes we say this about masks and then we say that about masks, and we're going to go through all of this with you. But it's in response to the changing guidance that we receive. We know that if we work together, we're going to accomplish the goal of providing outstanding services to our children. So working together means making sure that we're working with our partners at the EACC. So I'm going to turn the presentation over to Linda and Dawn and Kyle. Next slide, if you'll go over to Linda.
Okay. Thank you, Dr. Hill. Again, I'm Linda McLaughlin, the EACC president, and I'd like to speak just really briefly about our EACC priorities, because our top priority is the health and safety of all of our employees here in Charles County. Now, in addition to that, we are prioritizing advocacy around resources, adequate staffing, and maintaining employee benefits to make sure that employees have all the support that they need to do their jobs. And as Dr. Hill said, EACC is continuously communicating with CCPS to make sure that employee voice is considered when these decisions are being made. We want to make sure that we are communicating effectively to lessen the anxiety of employees. We know there's no playbook or script for how to make these decisions in the middle of a pandemic, and we also realize that each new thing creates its own new and challenging set of questions. Open communication is key, and it can help solve problems at the lowest level. Balance, boundaries, and self-care are super important. So from the very beginning in the spring, when schools were shut down, EACC committed to communicating with both CCPS and our members regularly to keep everyone as up to date as possible and to solve issues as they arise. This town hall is just one small part of the way we commit to continuing to collaborate and communicate to support our members and the strong educational community here in Charles County. Community collaboration and clarity are the keys to our success, and it is our hope that this town hall will provide some of that clarity. So in the next slide, I would like Dawn to touch on the things that our advocacy and collaboration have done.
Good afternoon, Charles County Public School community. I want to go over with you just a small part of the ways that we've been communicating. Since I joined EACC on September 2nd, I have joined weekly calls with Dr. Hill and your president, Linda McLaughlin, to continue to talk about the challenges that we face every day and to make sure that we are advocating for you in every way that we can. As you can see on the slide, and I'm not going to read it to you, EACC and employees were represented on all of the reopening task force committees. We also have been engaged in recent conversations when calendar adjustments were made to remove the 3 half days in the first quarter to make sure the contractual planning time was still honored that normally happens on those half days. We're in the process of discussing some changes to evaluations through a memorandum of understanding that we're trying to do in partnership to get ahead of what decisions may be made at the state level. We've had extensive conversations with Nikki Majors and the HR team about the implementation and the process for accessing the Families First coronavirus leave that was granted by law in the spring. And the HR team is ready to implement that process. Additionally, I, as recently as Friday, had a great conversation with Charlene Ogburn and the team who are doing the ADA accommodations, Americans with Disabilities Act accommodations. There are many, many employees who have accessed that process and are still in the process of getting a result from the HR department. So Charlene has shared the process with her, and I am working as members reach out to me about making sure they understand the process and supporting them in the process of requesting ADA accommodations if they have a medical diagnosis that would qualify them for that. And in addition, we're responding to concerns as quickly as we get them, and questions that we get that we don't have the answers to, we turn to many of the panelists that are on this team today to answer specific questions related to operations or instruction or anything else that might impact the things that you are thinking of and the concerns that you have as we navigate this uncharted time. Thank you. Next slide.
Good afternoon, everybody. This is Jason Stoddard, your Director of School Safety and Security. It is a pleasure to be here with you today and to go over a few slides very quickly, and then I'm sure we'll get more into the details with your questions. As you can see on the PowerPoint, well, the first thing we're going to talk about is the mask expectations for phase 2 and moving forward. As many of you have brought to light, there are some concerns about masks and how we are as the public schools going to handle that. There has been changing guidance over the last several weeks. This is something that continues to evolve, and hopefully we won't have to evolve it much more than what we see here. Only in a better way as this virus is hopefully more and more defeated. As we see the new guidance that we have put out, which was published in the COVID SOPs as of the 6th of October. So it's even changed since the most recent video and release that we did. The Charles County Public Schools now requires all students and staff to wear masks while on school property, in our school buildings, and on our school buses. The social distancing or ability to remove the masks when social distancing is available has been removed by the health department. So our new guidance at this point is that all students and staff will wear their masks when they are inside of a school building. The next question that we receive a considerable amount of is what about compliance to the COVID-19 rules and guidance? Ms. Holstein and her wonderful team have been working on a compliance statement and a compliance process, as it says in our COVID-19 SOPs, and I'll read it to you verbatim, and you're more than welcome to have copies of these, and they are posted or will be posted in our reopening plan as we update that. Students who knowingly and repeatedly disregard CCPS COVID-related safeguards, policies, and procedures will be removed from face-to-face instruction. The team in administration has worked on what I believe is a 3 strikes policy, in which it will involve counseling and then a referral back, and then a discussion with parents, and then a referral to admin. Ultimately, if kids knowingly and repeatedly refuse to comply with any of our guidelines and policies, which includes the mask wearing, they will be removed from online instruction. Kyle, you can go to the next. Our next slide talks about physical distancing in classrooms and hallways. We have, myself, Mr. Heim, and Mr. Schreck have visited a number of schools. There is no magical formula for each classroom. However, as we begin to prepare for phase 2, what we have found is a vast majority of the classrooms, both in open space schools as well as in the schools with regular classrooms, we can put comfortably anywhere between 10 and in some cases up to 20 students in classrooms, socially distanced at their desks 6 feet apart. There's a number of different factors that go into this, but like I said, there is no formula. Most of our classrooms can comfortably fit anywhere between 10 and 14 students. A lot of it depends upon ancillary furniture, as well as extra desks and cubbies and things like that that may or may not have to be removed or moved in order to take advantage of all of the space. As we move in one school, as we look at our numbers, as our registration closes this evening for numbers, this morning we were at system-wide roughly 2,494 students who said that they were going to return system-wide. In most schools, that's a number that is close to 20 to 30% of those who are eligible for phase 2. Most schools will hover, many of our high schools will hover right around 150 or less students. Many of our elementary schools will be less than, most of our elementary schools will be less than 75. So when we look at our schools, physical distancing and the ability to socially distance will not be limited because of the reduced amount of capacity. When we look at hallways, the administration team has looked at scheduling and how we can do block scheduling and how we can ensure that we're moving students as least as possible, but we understand that we are going to have students moving, and in some cases, teachers moving as well. But we want to limit the amount of movement or the amount of students that are inside of our hallways. That does not mean that we will not have classroom transitions. We're relying upon block schedules and some other innovative approaches to ensure that we're reducing the amount of people that will be in the hallways. However, in the hallways, understand that once again, masks will be required. Next slide, Kyle. As we move into, we received many questions, specifically recently about what data we are using. We've addressed this a number of times, but I'm more than happy to address it again. Just to remind you that every day, the Office of School Safety and Security does publish a daily intelligence briefing that is posted on our website underneath today's COVID-19 numbers, which can be found in the Road to Recovery portion of the Charles County Public Schools, or the Road to Reopening. We publish that every day, usually by about 11 o'clock to 12 o'clock in the afternoon. We utilize data from the Charles County Emergency Operations Center, as well as from the state of Maryland, as well as from Johns Hopkins. Predominantly and primarily, the data that we use is local data as well as state data. National data, which is talked about a lot in many of your questions. Quite frankly, this is a very pointed disease and targeted disease and where it is affected. We are most concerned with what is going on specifically in Charles County and the region, the National Capital Region that we share. The Charles County Public Schools, we use a number of different things to make our recommendations to the board that we believe that we have a plan that is sustainable and holistic and safe for both of our students and our staff. This is the recommendation that we made on for our August 31st opening, that we believe that we could open safely in phase 2. It is also the same recommendation that we have made recently that we can now, as of November 9th, open in phase 2. We don't just use one metric to determine that. However, 2 metrics that the state has identified are positivity percentage by jurisdiction, as well as the 7-day moving average for case counts of 100,000. Both of Charles County's metrics have been well below the state mandated average, which in some questions that we've received, are we using Johns Hopkins in the way that they determine those statistics, or are we using the state? The state asks us to use the state's data. So whether we use the Hopkins data or whether we use the state data, we are utilizing the data that the state has requested us to use. The next conversation that we routinely receive is about contact tracing and how we are handling when we have cases of COVID-19 in the Charles County Public Schools. We have always said in the number of public briefings that we've made that we knew that the Charles County Public Schools would not be a panacea where we kept COVID-19 out of our school system completely. However, we can operate safely with small groups as we have recommended in phase 2, utilizing the policies, the procedures, and the safeguards that we have put in place. When we have had staff members that have tested positive for COVID-19. We have never argued that we have not. We currently publish that data on the Intel Bulletin every day. As of this morning's data, We are at 13 positive staff cases since March 11th, which was the first case in Charles County. The Charles County Department of Health conducts all contact tracing investigations, and it will involve and could involve the school if there is potential exposure that occurs at the school. We must understand that the Charles County Public Schools are not, we are not medical professionals, and we do have limitations on some of the information that we can obtain through the health department. Next slide, Kyle. As we move forward, some of the questions that we've received have dealt with notification of people inside of the building that are positive. It is important that we level set the conversation and understand how this virus is transmitted. Even with the most recent information that has come from the CDC, acknowledging the fact that this virus is airborne, those of us who have been working this since day one have understood that from day one. This virus does not just crawl on the floor or on the walls. It must be transmitted from the surface or from the air into your body in one form or fashion, whether that is through your hands or inhaling it. This is one of the reasons that the masks are so important, and the fact that we wear them and encourage them, and it is an expectation in our schools at all times. If there is, or when there is, a case of COVID-19 in Charles County Public Schools, the contact tracers through the Maryland Health Department, the state of Maryland, will conduct that. They will contact the person who is positive. They will ask them a series of questions that involve who they have been around for over 15 minutes without PPE, who they have ate with, who they have shared utensils with, who they have been within 6 feet with for more than 15 minutes or had intimate contact, such as hugging, kissing, things such as that. And those people will be contacted by the contact tracers. If the Charles County Public Schools receives notification that we need to either shut down or that we need to have a discussion about shutting down a building, or more specifically and likely a classroom, that information will come from the health department, and we will work in collaboration to make those decisions. Community notifications of impacted specific schools, we will do at the recommendation and the request of the Charles County Health Department. We are not able to publish individual school reports of cases because of HIPAA and because of the small amount of cases that we have throughout our jurisdiction. It will violate privacy rights of the individuals who have tested positive. Next slide, Kyle. As we move into the next slide, as it revolves around PPE, as I like to say, we have 99 problems to worry about, and the personal protective equipment that we have put together is not one of them. You will see some numbers on your screen. We are very confident in the stockpile that we have created. However, there's a couple caveats that go with that, and this will require all of us to work together. We have made a centralized ordering process for personal protective equipment that comes through the Office of School Safety and Security. There is no reason for people to be ordering it on the open market. Everything should come through our office. There is a worldwide shortage of N95 masks, of disposable gloves, and of gowns. As you see on the screen, we have over 172,000 masks. Those are surgical masks as well as cloth masks that can be worn by staff or students. We have roughly 10,000 specialized masks. Yes, we have had to prioritize who gets some of those specialty masks as it sits today. We are always receiving new inventory from the health department and from other sources, so those rules may change. I know that some people have raised concerns about the amount of masks or transparent masks or things like that. Those rules were put in place to ensure that we could supply as many people as we could as we prepare for phase 2. However, we fully anticipate that we will continue to receive PPE from our suppliers so that we can increase that and continue to give our educators the supplies that are needed. Early on in the crisis, we did anticipate that we would have staff that wanted to wear face shields every day in conjunction with the masks. Face shields do not replace your mask. We do have enough face shields to issue one face shield to every staff member if they choose to order one. We have hundreds of gallons of hand sanitizer, as well as we have portable hand sanitizer and wall mount items that are going in as we speak at some schools. Additionally, we have solved much of the problems with disposable gowns by ordering washable gowns early on in this crisis. We also continue to get some disposable gowns from the health department through their stockpile. Those washable gowns and disposable gowns will be prioritized to our regional special education programs, and they have been given instructions. Our schools, individual schools, have been given instructions on how they can order those things. We currently have over 900 cases of gloves. We will soon take another shipment of about 600 more cases of gloves, but disposable gloves are something that are very difficult to find. Just to give you a general idea of a case of gloves in normal cases would cost us about $17. And in some cases now they're going for as much as $120 per case. So they are very difficult to find. As we move forward, understand that we will continue to grow our stockpile of PPE to ensure that we can provide our educators with the appropriate amount of personal protective equipment so that they can safely do their job. At this time, I'll turn it over to Mr. Heim.
What this current pandemic has caused us to do is reevaluate the methods that we use, also the type of products that we use, and also look at best practices of other school systems, particularly those school systems that already have students and teachers back and are under normal circumstances as much as possible. Every school under every year before we open schools goes through an annual inspection led by April Murphy, who's our supervisor of operations, and her operations team. So each school goes through an annual inspection, and each school went through that annual inspection back in August. In working with Linda McLaughlin and some of the conversations we've had, we talked about doing a second round of inspections before we go into phase 2. So Ms. Murphy has already put together a schedule, and we will begin that at an appropriate time based upon when we feel we're going to enter into phase 2, giving us enough opportunity to go through all of our schools before we get into phase 2. In terms of the cleaning and sanitizing that goes on, the two products that we use, our daily product is Awesome, which is again an EPA approved product for cleaning and sanitizing public buildings, also for hospitals, medical offices, and so on. Another product that we use is Virex. So you've heard about our school system, but other school systems that use foggers and misters. We've already been using foggers and misters in the past. And what that is, it's a machine that's a backpack approach, the ones that we have. Some of them are on wheels that you drag around. But regardless of the type of fogger or mister you have, use the EPA approved product. And what it does is it sprays, you spray that around the classrooms, the hallways, other areas of the building. And obviously it's reaching much more contact surface than the typical using a bottle of sprays you see with this building service worker at Stoddard, and then the wiping down. So the foggers allow a building service worker in a much more quicker amount of time clean more surface area. And each school has a fogger and mister now. The high schools, which are obviously much larger in square footage, have 2 foggers, so those staffs can go through the entire building in a much quicker pace than a typical elementary school, which may be a third of the size of a high school. Our deep cleaning efforts go on in the evening times, and in this case, as we get into phase 2 on Wednesdays, when we're likely not to see students in the building. And what does deep cleaning mean? Deep cleaning, again, means that we're using those foggers that we're not using on a daily basis, but also it gives building service workers more time. So during the course of the day, the emphasis is on touch points, handrails, doorknobs, other things that are commonly touched, bathrooms, frequent cleaning of bathrooms and restrooms during the day. The deep cleaning efforts that go on in evening time are times that building service are in classrooms and other areas of the building without having to work around students or staff. So they have the ability to, again, reach more contact surfaces. wipe down windows and other things that may be touched also during the course of the day that they're not going to get to clean during the course of the day. Also, then they could get into cleaning of and vacuuming of carpets and mopping and sanitizing of floors, and obviously spending more time in the bathrooms and other common areas of buildings where you're going to see more interaction or more people in and out of. So, those are our deep cleaning efforts. We do make sure that, and always, even in the past, that our building service workers have the proper PPE when they're using these products. So gloves and masks for these products when they are in use. And in terms of our building service staff, our teachers, but all CCPS staff have gone through mandated online training. Every year, staff, as they return to work in August, take these online mandated courses. We added 4 courses this year for that, and those 4 courses included reopening your organization, cleaning and disinfecting your workplace, CDC guidelines for making and using cloth face mask coverings, and then managing stress and anxiety during the pandemic. Next slide, Kyle, please. Signage. So it's very important for our staff and for our parents and for our students to be educated on what the proper protocols and proper hygiene practices that should be used on a daily basis. So we've made sure that it is part of our communication for staff and for students. And when students come back into the buildings, the signs are very visible throughout the building. So you're going to see signs posted at entrances informing visitors and contractors that masks are required. You're going to see other signs in common areas of the buildings and in restrooms talking about proper social distancing, 6 feet of social distancing, also good hygiene practices about not touching your face and frequently washing and using soap for your hands. In those cases in classrooms where there aren't sinks, we've gone ahead and purchased hand sanitizer. So every classroom has a 1-gallon jug of hand sanitizer. And we're in the process of making sure that every classroom will have a wall-mounted hand sanitizer, and we'll eventually be able to replace the large jugs that are currently in the classroom. So we received about 50% of those wall-mounted. They're being in the process of being installed in classrooms right now. And as the additional ones are received, they will be placed in classrooms. So every classroom will have sanitizer, and for those classrooms that do not have a classroom sink within them. Another step that we made going back to before schools closed back in March is we moved away from the non-alcohol based sanitizer to currently we're using hand sanitizer that has at least a 60% alcohol based component to that. In common areas of buildings, we have freestanding hand sanitizing dispensers. So as students or staff are moving about the building, if they're going from one area to another, they can sanitize their hands. In terms of facility information, since March, it's been vital that our building service staff, but also our maintenance staff, are making sure that exhaust fans in buildings are operating. That includes exhaust fans in restrooms, in locker rooms, in the kitchens and other areas of the buildings where you would see exhaust fans. It's very important that, and number one, that we continue our preventative maintenance, but the important fact is that we have a preventative maintenance plan for our heating and cooling systems and our filter systems. And we have dedicated staff who go through and change those filters. And our filters are changed based upon the type of the filter, at least one time a year to as many as 5 times a year based upon that type of filter. And again, those are dedicated maintenance staff who do that under the direction of Steve Vance, our supervisor of maintenance. So it's not a situation where we have people that that aren't skilled in that changing out those filters. Also, we've been involved in flushing of our water lines. So obviously, with the school closures that began back in March, we've had a tremendous decrease in the usage of water. So it's been vital that we try to replicate as much as possible that same amount of usage and more importantly, flushing water lines. So it's been a normal part of the daily operations of our building service workers to make sure that they're flushing sinks, water fountains, and other water lines in the building. And we also have a dedicated staff member who went through in July and August in each school and flushed all the water lines, and again is finalizing the schedule right now, which will resume in mid-October, where again one dedicated staff member will be visiting each building and flushing each sink, water fountain, everything, any water outlet in a building for a minimum of 3 to 5 minutes in advance of hopefully moving into phase 2. Going back to March and through July, as we opened our Starkey building, our central office, forced returning of staff and moving from 50% to 75% of our staff members in our office buildings, our supporting offices. It was important that we installed plexiglass, which you'd see in grocery stores. So as you've gone to grocery stores or Walmart and you go to the checkout counter, you see that plexiglass or plastic barrier. So in those front areas of offices where staff is receiving visitors or contractors, whoever it may be, into our buildings, we installed plexiglass. So during that brief interaction between that staff member and the visitor or the contractor, there is that barrier between them, along with keeping in mind the 6 feet of social distancing and along with wearing masks. And in terms of our, it's important also to keep in mind that even though our buildings were closed for students since March, our buildings remained operating since March. So there have been varying degrees of staff in that. So yes, at times we did cut back on the number of building service workers during the months of April and May, and we cut back on the number of maintenance workers. But our buildings continue to fully operate. Those HVAC systems continue to fully operate, and our cleaning and sanitizing procedures were kept in place during that time. So they were not shut down with nobody in and out of those buildings, but we did make sure that we had the proper procedures in place for those visitors or staff who were continuing to come into our buildings during that period of time. Kyle, next slide, please.
Good afternoon, everyone. My name is Charlene Ogburn. I'm the Supervisor of Employee Services within the Office of Human Resources. I'm going to talk briefly to you about our processes and what we do when we are notified of a positive COVID case. Jason Stoddard has shared a lot of information about how we're dealing with COVID in the school system, but I'm going to just share briefly what our protocol is when we get contacted that there's a positive case in our school buildings or even in our if there's one in our central office building. When there's a positive COVID-19 case, HR is normally notified by the individual supervisor or principal if they don't contact us themselves. When we contact the individual that's been identified as a positive COVID case, we're contacting them first to share our concern and make sure they're okay, and see if there's anything we can offer them as it relates to any employee benefits or anything like that. But we contact them, and then we advise the employee of our protocols as it relates to sick leave, what Jason Stoddard also shared in regards to the Families First Coronavirus Response Act benefit, and then finally our return to work policy. There have been questions regarding how an individual returns to work, and so if you don't know, don't hesitate to reach out to us and we'll provide you that information. If there's a suspected case of COVID-19 or an employee suspects they may have been exposed, as Jason also mentioned, there are guidelines that determine if there was in fact an exposure to the infected person. If the employee has not yet been contacted by the health department contact tracers, we contact them and ask the same series of questions that Mr. Stoddard mentioned earlier. After we ask those questions, then we advise them what to do as it relates to what the contact tracers will tell them as it relates to quarantining if that's necessary. We want to first make sure there has been, in fact, a true exposure to an infected person. And then finally, if an individual is not sure what to do, the first thing we want to emphasize from a human resources perspective is, number one, if you have a family member or someone in your home that has been tested or suspected a positive test rate, we want to make sure that you are not coming into our buildings if you know for a fact someone in your home or has been infected with COVID or being tested for COVID. We've received several inquiries regarding suspected second, third, and fourth party exposure. When in doubt, reach out. Contact the Office of Human Resources so that we can inform you of the proper protocols to suspected exposure. We are not the health professionals, as Jason Stoddard mentioned before. but we do our best to follow federal, state, and local health department guidelines to make sure we're providing our staff and employees with the most current information as it relates to COVID-19. Kyle, next slide.
Good afternoon, everyone. This is Nikki Majors, and I oversee HR service delivery in the county. And I'm going to talk about the Americans with Disabilities Act and our workplace accommodations process. This is a very popular topic right now because of COVID. And I want people to understand that we are required by law to follow all of the requirements of the Americans with Disabilities Act, as well as the EEOC. So all of their guidelines we have to comply with, otherwise we get in trouble as an employer. And I think many people have been a little bit frustrated that it's taken a while to respond to their accommodation requests, and that's because the process isn't one that happens overnight. For us, the interactive process starts when you, the employee, request a workplace accommodation. So we recognize that request, and we may come to you and gather information, because we need information in order to determine how best we might accommodate you and ensure it's not an undue hardship to the employer or its operation. So it's necessary that we request from you documentation. Sometimes a doctor's note is not enough, which is why we have forms that we ask you and your medical provider to complete. So once those forms come back to us, we have a committee of 7 individuals who evaluate that information. It's not one person making a unilateral decision as to whether or not you will receive an accommodation, and if so, how. It's a group of individuals who come together collectively and evaluate your situation. So once we've identified what the limitation is that's causing a problem for you in terms of performing the essential functions of your job, we're going to interact with you and have conversations, and it may not be just one, it might be 2 or 3, so that we can explore accommodation options. So we solicit from you and brainstorm ideas as to how we might best provide what you need in the way of an accommodation. And once we've explored that and we've mutually agreed on what we can implement, we actually work with you as well as your supervisor or principal to implement that accommodation, because we want to make sure that it's successful, and we want to ensure, again, that you're able to perform the essential functions of your job. A lot of people have come to us and simply said, you know, because of my high-risk condition, I need to telework. And I just want to share with you all that telework is not the only option. We have successfully accommodated many people from their work site. So sometimes it might involve, or we might agree on an alternate work assignment, for example, or restructuring of a job. We might modify someone's work hours so that their arrival or departure times are adjusted, or they need to take more periodic breaks, or, you know, altering the way they function and perform work during the day. It might even result in taking leave, or modifying a workplace policies. You know, for example, someone who has diabetes may need to eat or drink, you know, at their workstation, and we may have to modify a policy so that, you know, a person doesn't go into insulin shock if they need to immediately eat a candy bar or drink some fruit juice, for example. But once we implement the accommodation, we actually monitor it, and that is part of the interactive process once it's in place, because we want to make sure that it continues to be effective for the employee, and again, not causing any undue hardship to the employer, because we still have to carry out the business of providing teaching and learning to our students. And we understand that there are individuals who are significantly compromised with health conditions as a result of COVID. And so our employees who are most significantly compromised health-wise, we are very, very committed to helping ensure that you're able to carry out your job responsibilities in a safe and effective way. We have gotten questions around taking care of family members who are in the home and concerned about not bringing COVID back to the home. ADA is not extended to a caregiving situation, but we do have family medical leave, which is administered through the Employee Benefits Department. If someone is caring for a sick relative, that might be a route that they can take. But Americans with Disabilities Act is for your individual disability as an employee, not for your family member. So we as an organization do not extend ADA for caregiving responsibilities. And I just wanted to make sure people understood that. Next slide, please. All right, Ms. Ogburn spoke earlier about the Families First Coronavirus Response Act. This was a law that was enacted as a result of COVID-19, and the provisions of it are in place through December 31st of this year. So what it does is it affords employees paid sick leave for specific reasons related to COVID. And that paid sick leave is up to 2 weeks or 80 hours of time off for certain reasons, such as if you're subject to federal, state, or local quarantine or isolation order related to COVID, or if your healthcare provider has required you or advised you to self-quarantine. If you're experiencing symptoms of COVID and you're seeking a diagnosis, time off would be covered. Or if you're caring for an individual who's been asked to quarantine by their provider or is subject to a quarantine under federal, state, or local law, that would qualify. There's additional leave that's available up to 10 weeks for someone who might be, and we've had a couple of these situations, who might be caring for a child whose school or place of care, their daycare is closed and it's related to COVID-19. So this benefit is also administered under our Employee Benefits Department, but the Office of Human Resources can certainly answer any questions that you might have with regard to this expanded family and medical leave. Again, teachers, I think, are our most significant number of workplace accommodation requests. To date, we actually have 353. We are a staff of 17 in the Office of Human Resources, so we ask for your patience as we vet these 350 plus accommodation requests. We work on them on a daily basis, and we're already looking at the phase 2 requests and have already started the process of responding back to individuals who submitted forms for phase 2. But as I described earlier, that interactive process does not happen overnight. It is a conversation where we work with you as an employee. So, you know, for those individuals who are anxious, we understand, and we are working as quickly as we can to be responsive. We have not forgotten about you, but we are dealing with a significant number of, a significant volume right now. So again, if you have a current medical condition and you haven't submitted your request, please go ahead and do that. You can email our accommodations@ccboe.com and we'll respond to you with the necessary forms that you need. And if you have questions, let us know. You can reach out to us by phone or email. Next slide.
This is Mike Heim again. I'm going to speak on behalf of Brad Snows, our Director of Transportation. First of all, we work with 27 independent bus contractors, so we have a combination of system-owned buses and contractor-owned buses, which provide about 285 daily route buses that transport on their normal circumstances over 23,000 students to and from school on any given day. And part of that is annual training that all bus drivers, whether they are CCPS employed or they're contractor employed, but through COMAR and MSDE, every bus driver and a bus attendant in the state of Maryland has to go through 6 hours of annual training to keep up on current events, but also as a refresher course for key safety topics in transportation. We have, as a school system, provided in advance to the independently owned bus contractors PPE. So we provided masks for drivers on those buses, but also a supply of masks in the event that a student comes to the bus stop and has forgotten their mask. So we have disposable masks that have been provided to each bus contractor for each bus. In terms of bus safety inspection, again, per COMAR, MSDE, all school buses in the state of Maryland have to go through 3 annual bus inspections, and any bus between the age of 12 to 15 years goes through a 4th bus inspection, which is done by an independently, privately owned shop that would service or do bus inspections of diesel vehicles. In terms of bus cleaning, sanitizing protocol, it is expected that in the PM run after the bus is ended each day, and again, we provided cleaning products and spray bottles to the bus contractors. So again, that's something that we provided to them, and it's awesome, which is the same product that we are using in our classrooms is provided to use on the buses. So at the end of the day, it's expected each bus goes through a deep cleaning by that bus driver or that contractor before that bus hits the road again the next day. Between each route, we're expecting that commonly touched areas are clean and sanitized. So the handrails as you go up the steps on the bus, the seat backs as you're sitting in the bus and you're facing forward in case kids are touching the seat backs, we're asking that those are sprayed with that cleaner and wiped down between each run. And then in the morning time, after they finish their 3rd run, which is after their high school, middle school, and elementary run, we're again asking that those buses go through a deep cleaning just like they would receive in the afternoon when they completed all 3 of their afternoon and evening runs. In terms of bus configuration, we are working with having 1 student per seat with the exception of the immediate seat behind the school bus driver. So 1 person per seat, 1 student per seat, with the exception of families. So siblings can sit more than 1 person to a seat because obviously they are living together in the same household. In terms of loading and unloading buses, the first person who gets on the bus in the morning sits in the back of the seat, and you fill the bus as you get to that last bus stop in the morning time. And then in the afternoon, you do the reverse. So if I'm the first person off the bus, I'm sitting in front of the bus. And if I'm the last person off the bus in the afternoon, I'm in the back of the bus. So things that we can do to try to prevent as much, crossing of paths between students while they're on the bus. And as Mr. Stoddard had mentioned at the beginning, bus drivers and students will be wearing masks the entire time that they're on the bus. Additional safety protocols is that we'll crack windows when we can on buses. Obviously, as we get into the winter months and hopefully we're into a phase 2 or phase 3 or phase 4, and those times occur during the winter time. Obviously, we don't want to have too many windows open because then we're going to be dealing with kids being too cold on the bus. But we'll do what we can in terms of additional ventilation on those buses. And it's just like we talked about with operations and maintenance staff who are constantly working with their colleagues around the state. Mr. Snow and the other transportation directors, ever since going back to March, almost had weekly meetings, again, talking about the best practices and the latest information that comes out either through MSDE or the CDC, OSHA, and so on, to make sure that we have, again, the best and latest practices in place for making sure that we have clean and sanitary buses. At this point, I would turn it over to Ms. McLaughlin.
Thank you very much. So what we're going to do is the chat has been open for questions, and Dawn and I will be fielding the questions from the chat as well as from the questions that were sent in ahead of time. And so the first question is, I'm concerned that if there are multiple potential exposures requiring isolation and quarantine, that will impact pay during face-to-face instruction and not of our doing. Is there a plan to mitigate any lost pay? And I'm not sure who will take that, Dr. Hill. Perhaps you can.
Ms. Majors, you want to give that a shot?
Well, there should, the only, it would start with you, Dr. Hill, because I can't imagine that you're not going to pay people if we have to shut a building or if we would have to shut down, central office or school. I think that's what the question's referring to. If we have to shut down because there's cases of COVID, would we stop paying employees? I don't know why we would do that, but that would be at your level, we make that decision.
Right, and I agree with you, Ms. Majors, that, and I think that if employees think back to March, April, May, June, July, there was never a halting of people's pay. And we all need to be very honest with each other in the fact that there were a lot of people who didn't have any work to do. And we have worked very hard to take care of our employees, to make sure that we were being as fair as we can be. And hopefully we'll be able to continue that as we move forward. But we wouldn't be docking people's pay if we had to close their building.
Is that the spirit of that question, Linda? I just want to make sure we answered that one.
I'm not sure if that is the spirit of the question, but hopefully the person who asked the question, if it was not, will put a follow-up question in the chat. And we'll come back to it if that did not answer her question.
Okay.
So, Dawn, your question.
So as Linda said, we're alternating between chat questions and questions that have been sent in by staff. So now I'm going to ask a question that looks like a secondary question. It says, how will CCPS address concerns with lack of planning time at schools with traditional periods? Because now we're 100% virtual, and how will that change with phase 2 when much of the flex time students will be in the building and there will not, teachers will not be free to plan?
I'm going to guess that's mine.
Yes.
So we will hold to the legality of the EACC negotiated agreement that we have with our bargaining unit. I am meeting every single week with principals, and we will ensure, because we have to, and it's the right thing to do, that every teacher will get their 45 minutes of uninterrupted planning time a day. Phase 2, although we built the schedule with phase 2, phase 3, phase 4 in mind, it will be adjusted a little bit when we move back in. But I can guarantee everyone that's listening that every teacher will get their 45 minutes of planning time and their 30 minutes of uninterrupted lunch. It's difficult though. All of these schedules and planning that's going to go into reopening schools for a hybrid model, it's not easy. And every school might look a little different. But there are non-negotiables that we will make sure are in place, and that's one of them. That's a non-negotiable. And, just in case folks are wondering this, we made a commitment to all of you that Wednesdays were going to be for professional development and planning. And so because you have that extra time on Wednesday, that does not equate to not having that time on other days, because this new model has put all of us back to feeling like a first-year teacher. So we know you need the time. And so that's a non-negotiable. If you're not getting that time when you get back in person, you need to reach out to your principal first, work it out at the building level, and then if you still don't have the time that you feel that you need, then you need to reach out to your EACC rep and so on. But our building principals are working really hard, and they know you need the time. But if there's an issue that you're experiencing, reach out like you always do. But that's a non-negotiable on our side.
And Amy, if I could jump in before you all move to the next question, Linda. Another non-negotiable besides planning time is a 30-minute duty-free lunch. That's a contractual obligation that we have agreed to, and I know that some of our email questions regarding lunch were questions about that. Am I going to have to eat and then watch kids, or am I going to eat with kids? You are entitled, teachers are entitled to a 30-minute duty-free lunch, and that is a non-negotiable. So we will protect that.
So the next question asks, will there be consequences for students who may intentionally cough on their colleagues or on their fellow classmates or on staff?
No, I can take that one as well. So we have a protocol in place now that we will be sharing. And the protocol is, I think Mr. Stoddard mentioned it, that we have a verbal redirection of the child. Then the next level would be to contact the parent. And then the third is that the student then may be asked to move back to virtual instruction. And there's not going to have to be a big, long process that sometimes we have to follow with, so many days and all of the procedures that we a lot of times have to follow. We have to make sure that if we're bringing students back to school, that we're doing it in a safe way. And so if we have children that are not following the CDC guidelines that we have in place, then we're obligated to provide a free and appropriate education to everyone, but we can do that virtually. So there will not be a big, long process. We are going to ask you to work with our students. We know that there will be different challenges for students in our regionalized programs. That's completely different. But if you have children that are purposely taking their mask off, coughing on another student, then we will be recommending that child go back to virtual because it's not safe for them either. And we have to make sure we are taking care of our students and our staff and then educating. So that's the process, and everyone will see all of these protocols so that you're well versed on them. You can ask questions about them. If we forgot something, we'll be asking for feedback. So that's the procedure if there's a student who purposely is not following guidelines. We have great kids though, so I'm not too worried, that someone's going to purposely try to hurt someone.
Thank you. This question might also go to you, Ms. Holstein. There is a concern from elementary specials teachers that they may be required to travel from classroom to classroom to teach. Can you speak to that?
I can. And again, I know that everyone wants the definitive answer from us, and I can only be honest. And the honest answer there is that every school is going to look different. And I know that probably isn't the answer that everyone wants. But it truly will depend on how many students are coming back into a building to decide which teachers are going to be teaching from their classrooms, which classrooms we have to split in half because there's too many students coming back to social distance. And you all know there are only so many spaces in our smaller elementary schools. So we would like all of our teachers to teach from their classroom space, and we are very confident that we can move children through the hallways, socially distanced with their masks on, to go to a special area class. We're very confident in that. But what I can't answer yet is, will we need additional spaces to separate homeroom classes? And once the registration closes today, I want to publicly thank all of you who have made hundreds and hundreds and hundreds of phone calls trying to get our families registered. It has been a tremendous amount of work. Once we have those numbers, then we will be able to work with each school to help them develop what this blueprint will look like if we reopen in phase 2. So the answer is, it's going to depend on each school and how many students are returning. But our first wish is that everyone teaches from their own classroom space. I think people feel more comfortable when they're in their own classroom.
Thank you. I think this next question from the chat is going to be answered by Mr. Heim for Mr. Snow. This is a bus question. And this person's son catches the bus and goes to St. Charles and then takes a bus to North Point. On the way home, they ride from North Point to T.C. Martin. How is this being handled with so much contact on the buses involving so many schools?
So we'd have the same procedures in terms of how that student would get from location to location as that person mentioned. So we have shuttle services. If we don't have direct routes, express routes in the morning time, from neighborhoods to North Point for students outside of the North Point zone. So they go through the high schools for which they would have typically been zoned if they weren't accepted in the North Point program, shuttle through there. Then in the afternoon, they have to shuttle through the elementary schools because the high schools have already dismissed. As I talked earlier about the cleaning and sanitizing of our buses. So between those routes, there should be cleaning and sanitizing of the handrails and the seat backs of those buses. So as that kid moves from one bus going from, say theoretically, from their neighborhood to La Plata, and they jump on that shuttle bus would have been cleaned and sanitized, hitting the touch points before those kids get on. And then the same thing would happen in the afternoon when they go from North Point to TC Martin. In this case, the bus that they're getting on at TC Martin, before either, if it was doing a high school, middle school route before that, there should have been a frequent or a cleaning of frequently touched points on the bus. Again, the handrails, seat backs, and again, in the AM and the PM, after the completion of the routes, they would go through a more thorough, deep cleaning. But we'll use the same shuttle services as we always had to get students to and from their schools.
Thank you. Next question is from some of the questions that were turned in ahead. If our students on our assigned caseloads are all choosing to continue to participate virtually, will we be given the option to continue to telework?
Nikki, do you want me to take that or would you like to take that?
Did you repeat the question?
The question is, if our students on our assigned caseloads or class loads are all choosing to continue to participate virtually, will we be given the option to continue to telework?
Amy, you and I would have to decide that together, I think, in the case of a teacher.
My first inclination would be when we open in phase 2, you really need to have a medical accommodation in order to continue teleworking. We are going to need all hands on deck. So that would be my initial response. Certainly something that we can talk about, but my initial answer would be that unless you have a medical accommodation, we really need you back in the building.
So next question from the chat. As an itinerant teacher, I teach at 4 schools. Has there been any thought of a county directive to limit travel for itinerant teachers because they're exposed to so many more different students across multiple buildings?
I can start with the PPE part versus the infection. As long as our teachers are wearing their PPE and doing the things such as practicing good hand hygiene, limiting their close-up time and wearing the appropriate PPE, the chances of spreading the virus from building to building, even if you're required to move from building to building, would be greatly reduced. It's never going to be zero. It hasn't been zero when we had the flu and only had to worry about the flu. However, if we practice the good safeguards that we put into place, we utilize the hand sanitizer, we wear the masks appropriately, we limit our close-up time with people, the likelihood of transmitting the virus is greatly reduced. I can't answer the travel question. That is outside of my lane.
So my answer there would be we have our itinerant teachers because we have caseloads and we obviously don't have enough itinerant teachers to have a full time at each school. I would say though that if you're an itinerant teacher and you have a good idea of something that we could consider, send it to us. I, off the top of my head, can't think how we would meet kids' needs in 4 schools without hiring additional staff. But I would love to hear from our itinerant teachers if you have maybe an idea that we could consider to limit your travel. I agree with Jason about the PPE and limiting exposure, but I understand how you're feeling about moving to different buildings. So we would be happy to discuss it with you. If you can come up with some alternatives that would work for everyone, send them in. Be glad to discuss it.
Thank you. This question is sort of about itinerant teachers as well as disposable PPE. Mr. Stoddard, I know you talked a lot about having lots of masks and things like that. Will the teachers who travel back and forth from different buildings be provided with enough disposable masks to prevent cross-contamination and spread that way?
So I read this question earlier in one that was submitted, and I need some more details on exactly what is being asked. We wear our mask. You put your mask on in your office, and then walk in this building, and then walk through the building. You put your mask on in your car, and then walk into a grocery store. And I'm not quite sure exactly what the question is. If you wear the mask and you wear the mask appropriately, you put the mask on. We're not shaking the mask off in the classrooms. We're not doing those things. There should not be any cross-contamination concerns. However, if that individual who asked that question can reach out to me, I can get some more specifics and answer that question.
Okay, thank you very much. The next question from the chat is from someone who is an educator in the Achieve program. And they say that their children will not be able to wear a mask all day in the Achieve program. One student will not wear one at all. And what would be the process there?
So we're talking about what kind of documentation that we're going to require for students that have a medical exemption from wearing a mask. So stay tuned for that. I don't want to give you an incorrect answer. We just met about it today about what exactly we're going to need. Are we going to need something from a doctor, or what documentation will we need? But our Achieve educators just do a phenomenal job, and we know that they're worried. So for all of our staff in Achieve, Mr. Stoddard has ordered PPE that we know will keep you safe. So you will have the mask on, the face shield. I'm going to let him talk about the type of mask if he wants to add in. We have purchased gloves, and we've purchased the robes for, the gowns for you. So with all of that, if you have a student, and again, this is in the protocol that you're going to see, that you believe, even with all of the PPE, that there are things that are occurring that you feel either you or the other students or the Achieve student really is not safe, then we would contact the parent. But we know that our students in our Achieve programs and our other regionalized programs, SOAR students, are going to have a challenge keeping masks on. So we have to protect our staff, and we believe we're doing that with the additional PPE. Principals have an easy process. Mr. Stoddard did a fantastic job putting together a PPE catalog so that there will never be a day where we run out. But when you know your kids best. So when your students come back, if you have a serious concern that PPE is not keeping you safe because of the behavior of a student, start the process. Okay, Mr. Stoddard, do you want to add something that I didn't add? Because I know you sent a special list of PPE for regionalized teacher.
I did, and we continue to address as many of those issues as we possibly can. And I think the important part here is we talked about, we're building this plane as we're flying it, and we continue to explore as many different PPE options as we can. It's been said and repeatedly written in some of these things that the CDC guidelines are saying, we wear the PPE plus we need the social distancing. Yes, that is true. However, there are cases in which we're going to have teachers that either through their own voluntary use or through the use because of, especially in the Achieve and the Aspire program, have to go within that 6 feet. And we understand that. And that is why we prioritize we prioritize the PPE to you. And we continue to work to find additional PPE that may be appropriate for you. We continue to look at different training options. We continue to look at different things to keep you as safe as possible. We also need to understand that the risk has never been zero, and it's never going to be zero. However, we are going to do everything that we can to abide by everything that we're required to, which is to provide you with the safest working environment possible. So we will continue to explore. We are more than everyone that sits on this panel is worked every day to try and do everything that we can to keep our staff as safe, all of our staff as safe as possible. And we are more than willing to look and to listen, and it would challenge you and encourage you to bring suggestions to us to make sure that we're doing the best that we can. We all want to listen, and we all want to do the things that we can do to make this the safest working environment possible. However, there have been and continues to be schools that are opening very successfully, schools that are very close to us that have opened in what we're calling phase 2, schools across this country that have opened very successfully. And we can emulate that and do this, and we have built a holistic approach to it. So stick with us. We understand the anxiety and the fear, and likely very little that we're going to say here is going to reduce that greatly. However, understand that everybody that's worked on this since day one has poured their heart and soul into it, and what we care about is you. So we will continue to push that and continue to do everything that we can, especially for those regionalized programs and the amazing educators that we have in there, but also for the rest of our staff.
So this question came from a pre-submitted list. So with the weather turning cooler and heading into phase 2 potentially, what if anything is being done with the inside ventilation inside the schools, upgraded filters, airflow, etc.? Since open windows will sometimes not be an option, especially with classrooms with no windows.
All right, this is Mike Heim again. First of all, I'd like to start with a definition for ventilation, and this comes from the American Society of Heating, Refrigeration, and Air Conditioning Engineers. So this is the Holy Bible for those folks who work in the HVAC field. And again, this is an independent organization. This is not a government agency. So, try not to bring any politics into this. I think it's very important for all of us to understand what the definition of ventilation is. And that's the process of supplying air to or removing air from a space for the purpose of controlling air contaminant levels. So as we talk about filters, that's where that comes into play. Another thing with ventilation is humidity. So we're drawing outside air into all of our systems. So every one of our schools and every one of our office buildings, by design, those systems bring in fresh air. Now, the level of fresh air they bring in depends upon that particular unit and when that particular unit was manufacturing. But typically, as we are conditioning the air, you're bringing in on average of a minimum of 20% of fresh air and mixing that with the current air inside of the building. And then continuing on in terms of ventilation, it's also dealing with the temperatures in that space. So HVAC systems do three things. They try to filter the air. Obviously, they want to condition the air. So if it's cooling season, they want to make that an acceptable desired temperature for making that a cold atmosphere. And also they have to consider, since they are drawing air from the outside, the humidity levels. So obviously, cooling systems, air conditioning systems will work much harder during the summertime as they draw that fresh air in from the outside, because for those weather geeks out there, we know that our humidity levels are much higher during the late spring, summertime compared to the late fall or winter time when our air is typically drier. But regardless, whether it's heating or cooling season, our systems are drawing in fresh air from the outside and, again, conditioning that and mixing that with recirculating air from the inside of our buildings. I'm going to continue to go on this tangent because I know there were lots of questions as I've been seeing the questions pop up. So continue talking a little bit more about ventilation. Another thing, buzzword that's out there are air change rates. And the air change rate is the airflow and volume units per hour divided by the building space volume in identical volume units, normally expressed in air changes per hour, HCH or HBH. And to go into that a little bit, basically you're looking at how often the air is exchanged in a classroom, cafeteria, or other areas of a building. So when those buildings are designed, it's architects and engineers who are specialists in their fields who are along working with the school system staff to determine what systems are placed in a new building as that's built, but also as we replace systems in a building. So the design is based upon square footage of a building and the intended number of occupants in a building. So again, the volume, the square footage of that building is taken into consideration, plus the number of people that are expected to be in that, and that helps to decide what systems are purchased for and operate in each building that we operate. So a properly, operating HVAC system, what it does, and again, just to go over this, it's controlling temperature and relative humidity to provide thermal comfort in a classroom or office area. Distribute adequate amounts of outdoor air to meet ventilation needs of school occupants, and isolate and remove odors and other contaminants through pressure control, filtration, and exhaust fans. And as I mentioned, as part of our preventative maintenance, depending upon the type of filter, our filters are changed out either 1 to 5 times a year based upon the specifications for that filter. I know we've seen questions, people want to talk about MERV. What's the MERV rating for filters, the minimum reporting value for filters? All of our filters are minimum of 8, and if you've seen ASHRAE and the CDC, they're recommending between 13 and 14, which is a higher rated filter. But they also, if you read further in the small print for ASHRAE and the CDC, not every system can handle a MERV 13 or 14 filter, because what that filter does, it's letting less airflow through, and what that does, it affects the fans and the motors that operate to try to push and pull air, as we talk about supply vents and supply ducts to push the air through the building, but also as we talk about return vents and ducts, the fans and motors that operate to pull air out of the classroom. So as you use those higher filters, it's restricting the airflow through there, because obviously it's trying to pick up or filtrate more filters as it does those activities. The issue is some of those older systems, and beyond, quite honest with you, some of the newer systems can't use a 13 or 14 because of the size of the fans and motors that operate those systems. But regardless, we already had a preventative maintenance plan in place for our filters, but also for the HV system. So our chillers, our cooling towers, our boilers, and the other components that go to operate those are inspected annually, but also are serviced and cleaned annually as part of our preventative maintenance that we already had in place. And you talk about, I've seen questions about ventilation in portable classrooms. So let's talk about that. So you have 2 types of HVAC systems that are used in the school system. You have unit ventilators, which you see in portable classrooms, which are for individual units, and you have the central air handling units for our large buildings, which operate those. And again, we have preventative maintenance plans in place, and regardless of whether it is a unit ventilator or the large central system, again, they are both drawing fresh air in from the outside. And to be quite frank with you, this time of the year, as you think about drawing fresh air in from the outside, our outdoor temperatures over the last couple of weeks have been in the high 60s to low 70s. So those systems actually have to work less if they draw in more fresh air at this time, because it takes less to condition that, to cool that air, compared to the air that they draw in during the summertime, when we see temperatures in the high 80s and low 90s. And also the humidity levels are lower at this time of the year. So again, they're working more efficiently when they draw more air in at this time of the year. Some other things I wanted to talk about with ventilation, because I'm sure that they may come up. So people talk about, you see news stories and people talking, CNN and so on, talking about ventilation systems. This is again from ASHRAE and the CDC. There are no published laboratory studies showing whether this virus can be re-aerosolized from ventilation air filters or HVAC system surfaces and systems at this point. So yes, it's very important to, for people to be theorizing what may or may not be happening, but this information that you're hearing is not coming from any lab reports that have been conducted at this point. And also keep in mind is, and I'll equate it to your homes. If you feel air coming out of a vent, that's your supply vent. If you feel air being sucked into where you see your filters, and hopefully are changing those filters at least twice in your houses during the course of the year, that's the return vents. And so, if someone says there's no ventilation in my classroom, if you feel air being forced into your classroom, then yes, you're getting ventilation. And I had seen a question where someone said, because my desk is underneath that supply vent, I want to close that off or tape it up. Don't do that. That's what's bringing in some of that fresh air from from the outside. And obviously, you don't want to put tape or paper on your return vents because that's sucking some of that air out that is being breathed out from the people in your classrooms. And if you have questions whether you feel that those are not operating properly, then that's for myself and Steve Vance, our supervisor of maintenance, to get involved. And one last thing I want to talk about is, people say, well, my room is too hot. So does that mean that the HVAC system is not working properly? Yes, it's not conditioning that air, but again, if you feel air coming out through those supply vents, you're getting ventilation in your building. And I can equate this to your home system. So we get those periods of time in July and August when we get temperatures that don't drop below 75 degrees at night, and we have high temperatures, in the 90s with very high humidity, and you're trying to keep your house at 72, or some people that try to keep it at 68, and you never get to that, and the system keeps on running. So just because the temperature is not getting to desired temperature, that does not mean that there's a lack of ventilation in that room. And the same thing happens in the wintertime. If you try to keep your house at a temperature of 74 or higher, and we get those polar vortexes where low temperatures get into 0 at times, and maybe having to get into the high of 20s, and you get those for periods of days in a row, and you can't get that desired temperature, and it seems like your furnace or your heat pump continues to run nonstop. Again, because it's not getting to that desired temperature, but you're still getting ventilation in your house, and you're still getting ventilation in your classrooms, even if they aren't at the desired temperature. So I apologize for that tangent, but I know that I've seen some other questions pop up that may pop up in the near future here.
And before you move on, I'd also like to expand on something that Mr. Heim mentioned. And I've seen in the chat, the CDC did release some recent information about the aerosolization of COVID-19. However, the CDC only released information. They did not change any of their guidance that has been there for quite some time. They did not upgrade any suggestions for ventilation or anything else. However, what I would strongly encourage everyone to do who has questions about the recent information that the CDC did release, as of 2 days ago, I believe, is to read the full report, the full press release, and also the supporting documentation. And if you read that, one of the striking things that you will find is the CDC is acknowledging cases of aerosolization and the ability for this virus to be aerosolized in areas with greatly reduced ventilation where there has been an increase in exhalations, such as from singing or from working out. That is what the information says. So while the headline said one thing, the actual information inside of the release said something completely different. And again, we understand the fear and the anxiety and the bombardment of information, but we will do everything that we can to apply the guidelines that we are given from the Centers for Disease Control, as well as the Maryland Department of Health, as well as the Maryland Department of Education, as well as the state of Maryland. We cannot work off of simple information to make decisions. We have to have that guidance, and the guidance has to change. So please keep that in mind. I see the comments. I've seen the questions. That there is a tremendous amount of data out there. There's a tremendous amount of misinformation out there. But Mr. Heim explained to you how ventilation works. He is the expert in that. It's amazing the amount, because ventilation was mentioned. We've had a lot of people that have done a lot of research on ventilation. The people that do this and have done this for years are the experts in it, not just because we've looked up what a MERV 13 filter is or anything else. What Mr. Heim is explaining to you is what we all need to understand. And we are all doing everything, again, that we can to keep you safe.
So that's a good segue to the next question in the chat. And this has more of an instructional bent, I would imagine, Ms. Holstein. It says, what protections will be provided for band and chorus classes? So I'm assuming we're referring to those groups who would be exhaling through their vocal or through their instrument.
Not to get into all the weeds, I know that you all are meeting with Mr. Bodemer, and he's meeting with the experts at the state. So what we're looking at right now, I'll give an example, is that we were given the guidance about, and I'm not sure the word, the filter, something that goes on the end of the instrument. So Mr. Bodemer and I talked last week, is we need to collect data to see how many actual band kids are coming back so that we can purchase the right amount of the filters or the band covers to make sure that we have exactly what we need for all of our band students. I know that this doesn't seem like a good answer, but it's the best answer, is that children who are singing need to be socially distanced wearing a mask. And that is the very best that we can do. And, you know, some of these situations are not going to be optimal, but safety comes first. So if you're a chorus teacher and you have students in person singing, it's critical that you are spreading them as far apart as you can, and that they are just going to have to practice singing with the mask on. Now, I know that so many of you have found so many really cool apps that you're going to be doing virtual concerts. And all of the things that we're missing so much right now and our kids are missing. So we're looking forward to being able to hear our kids perform again. But for in-person students, we have to follow these guidelines, even if it makes it a little bit more difficult, a lot more difficult for the kids and for you.
Thank you. The next question is about student movement when we do have students back in the building. If proper sanitizing and precautions are taken, the question is about elementary school students traveling from class to classroom for special areas. I know you already talked about that, but what about recess time? And for that matter, at the middle and high schools, will the students be changing classes?
They will. And again, this is going to be in the protocol document that we're putting together right now. We had a group, I know that you all know this, but we had a group of stakeholders over the summer develop recommendations at the elementary, middle, and high school level. We had awesome people working on all these committees, and I think, Ms. McLaughlin, you were part of them. So we're using that information along with all the new guidelines, and then recommendations from our teachers and our school principals to put in best practices. So yes, elementary students can go outside for recess. They're going out right now in our learning support room setup that we have. They can go outside and play. We do have recommendations for when they're outside and playing. The key, though, is when they come in, we have to build in time for every student to have ample time to wash their hands. So all of those kind of safety protocols, everyone will be well versed on before we welcome the first student into the classroom. But absolutely, elementary kids, if weather is, appropriate, we will be allowing them to go outside. And I know just myself, just walking outside and getting some fresh air feels good. And our elementary kids are going to need that. As far as hallways go, working with the principals, we're going to have a staggered bell schedule. So we are not going to have crowded hallways with students all jammed together walking from class to class. That will not happen. We'll have, as Mr. Stoddard said, we have such a limited amount of students coming in. It makes it a little bit more manageable in phase 2. Now, we may have to change some protocols when we move through the phases, but for phase 2, let's do that successfully. We won't have a large number of kids in the class, and if we stagger the bell schedule, we should be able to keep everyone safe, socially distanced, moving from class to class.
Thank you. The next question from the chat was something we did discuss in the work groups, but this one will probably go to Mr. Stoddard. Why are students and staff not being tested for COVID-19?
As it sits currently, the CDC, the state of Maryland, and the Maryland Department of Health are not recommending testing for students or staff as they return. As it sits right now, there is still a shortage of testing. There's a shortage of response. If we test today, we won't get responses back for 3 to 5 days, depending on what the answers were. So, or depending on how the labs are working. So testing is not a entrance protocol that we're using right now. I know a lot of people want to compare and throw conjecture out there about football and baseball and all these other places. Simply put, we have been working with our partners at the health department to try and obtain some testing instruments and some testing things, and they're just not being offered at this point to schools. And there is no school system in the country that is testing teachers, or the public school systems in the country that is testing teachers and students on a daily basis. It is just not something that's recommended at this point, and the turnaround time reduces the likelihood that it would even be effective. We are utilizing the best technology that we possibly can. One other question that comes up all the time is about temperatures. As we discuss about temperatures, please understand that temperatures were removed from the priority indication for COVID-19 long ago by the CDC. A number of school systems across the country have attempted to take temperatures, and just about all of them have abandoned it because the health officials are telling us that it's not practical to begin with, and also it is not a good indicator. It is more of an optic than it is a protective device. We have to keep in mind that many of our schools are walking schools, and kids don't just walk normally to school. They play, they do things like that. They are always running around. They're being children. So of course they're going to enter the schools with an elevated temperature. That's not an accurate representation of whether they're sick or not. The CDC is reporting and has been reporting for quite some time that up to 40% of people are asymptomatic. So they're not going to show a fever. So for the Charles County Public Schools at this point, with the current guidance that we have, we are not going to utilize temperatures for staff or students to determine whether you can enter the building or we deny access. If the guidance changes, we'll be nimble enough, as we have been with everything else, to do that. But it is not more of an optic than it is a protective measure. And it's been that way for quite some time as the recommendations and as the information has come out from the CDC.
Next question from the chat. How will we utilize the flex times when students and staff are in the building?
So the flex times, again, will look different depending on what time of the day it is, if this student needs interventions, if this student maybe needs acceleration. It's really going to depend on what the student needs are. So we built that time in right from the beginning, knowing that going to in the secondary schools, going to 4 classes a day, that could give us that time for kids to have a break, because they do need to get off the screen, to give teachers a break, and to also have time to put in these extra interventions. Principals will be determining what the schedules are, though, because part of the reason of choosing special populations as our first group of students to come back is because we know that there are going to be learning gaps for significant amount of children that fall in these categories. Not all students, but many of them may have some gaps. And so this extra time in these small group settings, coming back 4 days a week, could really be a difference maker for students that are falling behind. But there won't be a one size fits all. You may have 3 children and 2 are in the elementary school are doing Dreambox, and another one is getting a reading intervention. It really will look different according to what the student needs are. But that time was purposely put there because we knew we needed it in virtual learning, but we wanted that to be there so that when kids come back, we do have some extra time, because that's always our challenge, even when schools are open normally, is we have so many needs of students, but we don't have time to do it all because we have to keep moving on. So in one way, this is a silver lining for us, that we're really going to get some extra time with small groups of students that maybe we can make a real difference for.
Thank you. The next question has to do with lunch for students and staff. We just talked earlier about the change in mask requirement. So how will we address that for lunch times for students and staff when they're in the school?
I think this is likely for me. So the guidance that we've received from the Maryland Health Department or from the Maryland Department of Health has been that we cannot use communal dining. It's kind of counterintuitive that we can't bring a bunch of people together inside of the buildings to sit for a long period of time. MSD has provided us with instructions to say that we can't use our at this point, we can't use our lunchrooms for communal dining. So the only option that we have is for our children to eat inside the schools. We do understand that the guidance that we have been given from the state of Maryland does not necessarily address it. However, we cannot eat through our masks. So we really have no choice but to allow our students to take their masks off. Once again, we're going to ask people to be reasonable. We're going to ask people to understand that there are very few bright line rules here, and that, yes, the kids are going to have to take their masks off to eat and drink, just like you are. And we'll have the awesome disinfectant there to be able to clean and to wipe off the desk if you choose. And we will make it work. It's not perfect. We have explored options. We have requested to be able to utilize our communal dining, and we are hopeful that we'll be able to do that in the near future. But as it sits right now, with the guidance that we have been given, and we're all about following guidance, and we've heard it over and over. I see it in the chat. I see it in your emails about following that guidance, and we must and should not pick and choose what we decide we're going to follow. So we'll continue down the path of the guidance that we're given in hopes that it will evolve as time goes on. But I think it's important to understand there is a number of school systems, to include ones that are very close to us, that have operated and are currently operating in phase 2 and moving quickly, very quickly, to phase 3 and phase 4, that we would call phase 3 and phase 4, that are operating under these same rules, that are operating under these same guidances, and are doing it very successfully.
The other thing that I think is important to point out is that we've had over 580 students in our buildings since August 31st in the student learning centers. And they have brought their lunch, and they're eating their lunch, and they're taking time for snack and that sort of thing. And our people have managed that. So we do have some experience with this, and we will continue to watch the guidance, as Mr. Stoddard said.
Thank you. The next question has to do with the conditions that might warrant a return to phase 1, like a rise in COVID-19 cases, a change in state protocols, that sort of thing, and about the decision to move to phase 3. What would be involved in that? But the first part of that question is what conditions might warrant a return to phase 1?
So I'm going to start, and Jason, if you'll jump in. The reopening plan was designed to be fluid and designed to be something that we could move forward in phases, welcoming more students back to our buildings, and then if we had to either pause or back up on phases. So we're going to be able to do that, and we'll do that by communicating with you all about where we are with the metrics and where we are with outbreaks, if there are any in our school buildings. So we make decisions to make sure our teachers and our staff are safe. Jason, I don't know what you would add to that.
So I think that the biggest thing to understand is that we are looking at this from a very local perspective, and it is over a trend line, not a one day up or down. And we see this all the time. We have not and will never cherry pick data. And we will rely upon the accurate and holistic picture of what goes on. We have seen how quickly we can close schools, and we've practiced it. It's always the first time that's the most difficult. And just like all of you, we found out in a press conference on a Thursday evening that Monday we would be closing. And it wasn't perfect. However, with everything that's gone in, the ability to go back to a fully virtual, God forbid we have to do that, but we have that capability and that capacity. We will work with all of our stakeholders. We have an amazing partnership with not only with the Charles County Department of Emergency Services, but also with the hospitals and with our health department and with the state on every different level to ensure that we're getting the most accurate data so that we can provide those recommendations. Many of those recommendations originate out of our office, and then they move up through the chain of command to the superintendent, to the deputy superintendent, to the assistant superintendents and deputy superintendents, and we watch that every day. We don't want to expose you to any more risk than is already out there. And if there's an outbreak that occurs that requires us to remove back, or we start to see the trend lines increasing like we did in April, then those decisions will be made very rapidly to move us back. However, keep in mind, we are seeing that those metrics go both ways, and we're seeing our metrics have remained very low for quite some time. And our metrics are well below, whether you utilize the Johns Hopkins information or utilize the state's information, our metrics look very well and indicate to us the science and the data that we all want to rely on when we want to rely on it, indicate to us that we can open safely. And our recommendation to go to phase 2 to our board is solid, just like it was in August. And we continue to move in that direction.
Thank you. The next question from the chat is, how will the assistance of special needs students be handled, particularly if they need a one-on-one assistant?
They'll be handled exactly like they are during normal times. So all of the instructional assistant requests, if they're not permanent employees, have started to come in. So we've asked our principals to start putting in the requests now so that we can start hiring now. So if you're a special educator who needs to have a temp IA, please make sure that if it hasn't been done yet, that your principal is sending in that request. Dr. Sotomayor and I look at the requests, and then we will approve if needed. I will caution you, though, just to wait until if you know that a student's coming back, that's fine. And I've received quite a few. But we're not going to approve until we know that the student is definitely coming back to in person. And then those requests will go to HR, and Tracy Matera does a fantastic job hiring all of our temps. So no problem there. There won't be any delay. And we're actually looking forward to being able to bring our temp employees back so that they can start earning a living again.
That basically a vaccine is likely to not be.
Sorry. Our next question is, when will I be notified if my classroom needs to be changed during phase 2 based on the number of students returning?
Soon. We can't do anything until we have a better sense, which we will, I think, by the end of the week, which students, families' decisions for in-person or distance. But the other important piece that we need to know is how many teachers will be receiving a medical accommodation, because there are a lot of pieces to this puzzle, as I know everyone can imagine. So it's not productive right now to start making all these plans without all the pieces to the puzzle. So as soon as we know exactly how many students, which programs, and how many teachers will be receiving an accommodation, then we'll start putting the pieces together. I know you need to know, we all know that. So as soon as we know if there's going to be a change, we will let you know. You're not going to know on Monday that you need to switch and start teaching something else. So our goal, though, is to have the least amount of changes for children as we can have. But I know there will be some changes. There will have to be. And there may be changes again when we move into another phase, but our goal is to make the least amount of changes as possible. It's already a few weeks in, but kids are attached to their teachers. And, we don't want to do that. But I know that we will have to do some, because there's no way to not make some changes if you have a group of students coming in and you don't have a teacher coming in. There's no way. You have to make some changes. But we promise that we will let you know in a timely way so that you can have enough time to plan.
Because the common cold doesn't kill you, but
So the next
And I
question
just
comes
wanted-
from the chat, and I think Mr. Heim and Mr. Stoddard have addressed this, but I want to ask it specifically because it's related to open space schools. So are there any other recommendations you gentlemen would share related to open space schools in terms of sanitation and cleaning based on the fact that the virus is airborne?
Okay. So again, based on the fact that that school, and I'll use McDonough as an example, or Stoddard Middle School, or Eva Turner, which is currently under a renovation. When those schools originally built and designed, obviously they were built for the intention of being open space schools. So the HVAC units that were installed for those schools were to accommodate, open space. And as we talked about, again, all of our buildings have a minimum of, at pretty much any given time, 20% of fresh air being drawn into those systems. But again, more importantly, earlier as I talked about, the change rate and the replacement of air, the existing air in those open spaces or individual classrooms and pulling that out. Again, those systems were designed to be meeting the same specifications for open space as they would for an individual classroom in terms of those change rates with that. One thing that I've seen some additional questions, and I had a staff meeting today along with Mr. Stoddard with some McDonough staff members, and McDonough, as I just referenced a few minutes ago, is an open space school. So they talk about windows. Can we open windows? I'm not saying you can or can't open windows. Obviously, opening windows does allow for some additional ventilation in a classroom or in a building. But you also have to be aware of other issues with opening a window. You need to be cognizant and aware of the fact of other staff members or students who are in those areas where those windows are open and any pre-existing conditions they have in terms of asthma or allergies. So as we know, we open up windows, we're now letting unfiltered air into the building. Unlike when our rooftop units are drawing in air, that air is being filtered before it's being conditioned and then pushed out through the building. So that's one concern with open windows. If I'm a teacher on the first floor of a building and I open my window, we know that leads to other potential safety concerns. So school systems, not only Charles County Public Schools, but school systems around the country have spent millions over the last 10 to 20 years to make our schools safer. So as we open windows, we are also opening ourselves up to other potential safety issues. We definitely don't want to have any situations where we are opening or propping exterior doors. One thing, at least with our windows, in terms of with having screens for windows, and not all classroom windows will open, but for those that do and have the screens, at least that is with the screens, it's not letting hopefully insects in, because we also know at this time of the year that hornets and bees are particularly aggressive, and we see that in playgrounds this time of year. So as we open windows, we also open her up to other things. So I'm not going to be going around, our staff's not going to be going around, because under normal circumstances, we have teachers who open their windows because they feel the room is too hot or too cold in that particular time of the year. So I'm not saying do or do not open your windows. Yes, it is allowing for other ventilation, but you have to be considered other health and safety concerns that go along with that. And also, if you're opening a window and the air temperature inside and outside is relatively the same, there's an effect that it doesn't draw in as much air. Or if it's a calm and not a breezy day, again, you're not going to get as much air coming in those windows. And also keep in mind, as I mentioned earlier, when you open up windows or allow for additional ventilation, systems themselves are not operating at their optimum capacity because they were designed to run when windows are closed. But yes, windows can allow for some additional ventilation in either a closed space or an open space.
I'd also like to add to what Mr. Heim mentioned. Please keep in mind, Starkey is an open space building, and we've been occupying Starkey since March 11th, and it has never stopped being occupied. Not a single case of community spread in the Starkey building. And this is, for lack of a better way to put it, it's a warehouse with a few offices on the outside and everybody else working in cubicles in an open space environment. So, and with one of the older air conditioning units in our fleet. So please keep that in mind as you're having these questions, that we are living this every day as well, and that we're doing everything that we can, and that to make sure that everything is as safe as we possibly can. We continue to look for better ways of doing things. There is no doubt about that, but we're living this every day as well.
Excellent. Thank you. The next question is about leave. This was a pre-sent in question, and it says, if we are forced to quarantine because we are exposed, why are we not permitted to telework?
So that question will depend, it will depend on if your role is conducive to telework. So for example, our teachers are currently teleworking in phase 1. So if you are required to quarantine and it's permissible via your principal and instruction that you telework, we may allow you to do that if you're opting not to utilize Families First Coronavirus Response Act leave, which affords you the time off for quarantine.
Okay, thank you. The next question is about in the schools with live streaming, do we need to stop live streaming when a face-to-face student reports they are sick and we need to call the nurse?
No, we're trying, although it's not. We're trying when we move into phase 2 with our new model for hybrid teaching, and really excited to roll this out to everyone. But this is as close to normal school as we can make it. So it's fine if a student isn't feeling well, you call the nurse just like you would normally do, follow those protocols and keep teaching. Just like we normally do when a child gets sick in the classroom. Hopefully, with our new hybrid model and all the new technology that we're utilizing, it's going to make this a little easier for you to be able to be up and teaching and live streaming while you have students in the classroom where you're not trying to manage being on a computer screen like this. But if a child gets sick, follow the protocol and do what we normally do. But you don't need to stop you don't have to stop the live stream. But that was a great question.
So the next question is discussing the hybrid model, and there are concerns about whether there are privacy issues with students being in the classroom and other students being at home on the video.
Those are tough questions, and believe me, we have spent hours with our staff attorney talking about them. But because we're in this current environment, that we understand the privacy concerns, but they are concerns that we're addressing at the county level. So my advice to our teachers is let us handle that and you take care of our kids. But we're all, that is a concern, and it's different than what we've ever done before. We're so concerned about privacy issues. But Mr. Schwartz is an expert. He meets with his colleagues across the state every week. So we are very comfortable with our model. And, I appreciate the question, but don't worry about the privacy issues. Let us worry about it and Mr. Schwartz worry about it. And we just ask you to take care of our kids and to teach the best ability that you have so that we can make sure that we're providing the best instructional program for our kids. Because I have no doubt that for a lot of our kids, the best part of their day is when they get the meeting notice that it's time for them to get on one of their classes. And they look forward to it, and they look forward to seeing their friends. So let us handle that one.
So there's a concern in the chat about the 3 violations rule for students. They're asking why we chose that progressive discipline.
We chose that sitting with all of, the staff here that we count as our content experts with school administration. We felt that was fair, that we give a verbal warning, because we don't just go from, with no teaching to a student or no reminder to a student right to, well, then we need to remove you back to virtual. But keep in mind, I really hope that our school community doesn't see this as a punishment or like a suspension, because this is not what this whole 3 3 attempts to have a child comply is not supposed to be a punishment, because as I said, we can provide the instruction virtually. We're proving that right now. So we would never skip the step where we talk to the child and try to have them understand the importance of following, our guidelines. And then we always include our parents. That's always our best practice. We never just talk to a child and then don't involve our parents. So if we've exhausted those 2, then we would make a recommendation and a referral that the administration needs to get involved, because right now, and I'm saying right now, this child is not ready for in-person instruction. Doesn't mean that in the future they might not be, but not right now.
Thank you, Amy. And I'd like to add on to that, Dawn, if you don't mind, because there was a question in the chat about what about coworkers, colleagues who don't wear their masks or wear their masks down around their chin, where it's not protecting themselves or others. And we would follow a similar process. I mean, Amy did a good job of talking about, kids are kids, and part of our job is to help to teach them the right way to behave in situations that are very unusual. And when it comes to staff, then if you have a staff member, a colleague who you feel is not abiding by the rules, then report that to your administrator. And then your administrator will address that with the colleague. But we're not going to immediately fire someone because their mask is below their nose. In the same way, we're not going to immediately say to a child, you go back to virtual the first time that their mask isn't worn properly. So what we're all trying to do, and I hope this has come across in the last 2 hours, we are right up 5:59. So if it's okay with everybody, I'm going to kind of bring us to a close here. What we've tried to get across to everyone who's listening and everyone who's participated in the chat is that we are learning as quickly as you are about all of these new conditions. And we are working very hard to try to anticipate and to try to address the concerns of our staff, the concerns of our students, the concerns of our community. But something that hasn't been brought up in these last 2 hours is that there is a large population of people in Charles County who wanted schools open on August 31st, and they want all children back in school today. And so we are in this place where we're trying to balance the needs and wishes of a variety of people and do it in a way that meets our mission. And our mission is to educate children. That's the business that we're in. And I've read all of the questions in the chat and appreciate all of them. But I wasn't going to say this, but I'm going to say it. The thought that we are just doing this willy-nilly and we are doing this without care for the people that we serve is disrespectful to the work that has been done. The people on this screen who did all of the talking here, I've been very quiet, are subject matter experts at what they do. And their job is to make sure that we're going to open schools in the safest way possible. There was a comment about, well, if the risk isn't zero, why are you opening? The risk is never zero. When we drive from here to home, when we go into a store, if we could fall down the steps, there are always risks. And our job is to mitigate those risks and do the best that we can do to achieve our mission. We are public education. And so our job is to provide teaching and learning for our children. And we're going to figure it out. But as was said by many of you, we're going to figure it out with your help. And we're going to count on you to continue to ask questions and to continue to provide situations and scenarios for us because it's helpful. And together we'll figure it out so that we can open schools, hopefully November 9th, in a way that everyone is safe and in a way that we are being able to reach those children who most desperately need us. So kind of a housekeeping thing, we're going to keep track of all the questions you've written in the chat, and we're going to provide a frequently asked questions page that we'll work with Linda and Dawn to publish in various ways so everyone can see what the question was and what the answers are in regards to those questions we didn't get to. But Linda, Dawn, all of our panelists, thank you all so much for your commitment of time, for your partnership in this effort. This is not easy work, but it's work that we're committed to, and it's work that we're going to continue to do until we have schools open for all of our children. So thank you all for joining us. Have a good evening, and we appreciate your involvement.